Tim,
Hi there.
how you doing?
I'm doing good.
How's life?
Life is awesome.
That's amazing. And you're
How
always
about you?
smiling. Oh,
Busy?
it's the best. Yeah. Yeah. I'm going to hit the start button. I want people to be part of this.
Practices back opening, practices ordering stuff.
Yep.
Good deal.
Yeah, we got ourselves into a little trouble, but it's been a good trouble. It's this whole PPE and all that stuff. And we were trying to help our offices to make sure that they have enough gowns. And I have a whole story, but we can talk about it later. Yeah, but it's been a lot of fun.
Keeps you on your toes.
Oh, yeah. I need it. How you been? You been bombarded by questions about what's going on and anything like that?
Oh, exactly. And the way I've characterized it, of course, this is my third time with you, and so I don't remember exactly what all we covered on some of those others. But yeah, the way I think of it, it's like tsunamis. And the first tsunami was when the whole thing kind of hit, and all the questions revolved around what do I do, and do I lay off, do I furlough, how do I close down, OMG, what am I, that kind of thing. That settled just a little bit. Then the second tsunami hit, which was the Family's First Coronavirus Relief Act. And of course, that built in all the stuff about sick leave, family leave, and stuff. So then it was like, oh, well, when I reopen, am I eligible? And do I have to do this? And what does it mean? And how much is it going to cost? And how do I implement it? And so that settled down just a little bit. And then the third tsunami, which was the CARES Act, and all the stuff about idle loans and PPP and the extra $600 in unemployment. And I know we talked about that the last time you and I were together. Mm-hmm. And now, sort of the tsunami now is, well, everyone's in the process of reopening, but then some employees are saying, I'm anxious, I'm scared, I don't want to come back. Some are saying, I don't have childcare now, what do I do? Some are saying, this is too freaky, I'm retiring, I don't want anything to do with this anymore. And so that's what's going on now. And as economies and states open, as you've seen, we've all read, the incidence or infection rates are going up. And so we're getting calls from dental offices are going, I have 13 employees and 9 of them have tested positive. Now what do I do? And so do you try to stay open and struggle along? Do you literally just shut down again for 14 days? And some of that depends on the state, because some states, Michigan and Texas, are saying, yeah, when that's the case, you're shutting down, whether you want to or not. So that's the one that is plaguing offices right now that we're helping people sort of sort through and navigate through. That's a long answer to your simple little question.
Yeah, well, it wasn't simple. It was. I was trying to get ready for the actual conversation. I know we're going to have a ton of questions related to unemployment and all these different things, but as people are jumping in on the call, I want to give them a chance to hear the whole story. What are the, and I'll write it down. What are the most maybe most asked questions in the last 2 to 3 weeks that you received, and maybe some that you're surprised the most about?
Well, probably the most questions land in one of two categories. And one category is this whole idea of reinstatement or reemployment, and how do I go about that if some people are saying, yes, I'm ready to come back, and some people are saying, no, I'm not, or I can't because of lack of childcare, things like that. So one category is this whole reemployment piece. And then the second category of common questions is this idea of complying with FFCRA, the sick leave, the family leave, and it pops up every once in a while where practices are thinking or assuming that they are somehow exempt from this. And when they come to learn that they're not, well, then they're into this mad scramble of, well, I thought I was exempt and I didn't have to think about this or worry about this. And oops, lo and behold, I'm not exempt. And the scramble to catch up, so to speak, and cover all the bases.
Okay. And why do you think dental practices think that they're exempt? Is there something that's out there that tells them that they might be exempt, or like where did that idea is coming from?
Well, you just said the operative word, and the word you said was might be exempt. So there is some provisions in the FFCRA that talks about exemption. And as a result of that, then everyone almost like wants to hope, wishing, hoping, dreaming that they are going to be exempt. But as you drill down into the criteria that would support an exemption, you come to realize, number one, dental practices are not exempt, just blanket across the board. Number two, the exemption, therefore, is not in any way, shape, or form automatic. Number three, there is specific criteria that must be met for the exemption to apply, and it has to do with the financial impact of this. It has to do with whether or not there are replacement employees available, and it has to do with the nature of this given person and their position. And even if you want to contend that one out of those three apply, well, then the next piece is the exemption, if it truly does apply, it only applies to that particular employee requesting leave right now. So it is done on a case-by-case, individual-by-individual basis. You have to have a whole slew of documentation. The Department of Labor is already seeing this huge increase of lawsuits because employers are claiming exemption and employees are filing claims. And there's just this incredible rise of lawsuits in this, and most everyone is getting knocked out of the box with it. Mm-hmm. And you have to keep, if that was not enough, you have to keep all of this documentation and information claiming your exemption or trying to defend or prove your exemption for up to 4 years. And I'm not sure any employer really wants that kind of dark cloud hanging over your head for 4 years.
Yeah. And what are the things like, first of all, what is FFCRI?
FFCRA, and that stands for Families First Coronavirus Relief Act. And that was the whole big first piece of legislation that got passed, and it went into effect April 1, and it stays into effect until December 31 of this year. So whatever
that's on the
6,
first
7, 8 months.
When you and I talked about like what person can stay home or like different levels, I think we've discussed that a lot. Like that you can claim certain not like a refund from a government if the person had to stay home and things like that. Was related to that, right?
Totally. Yeah. It just means that built in this. So we rewind back just real quickly. For all intents and purposes, FFCRA is wage replacement legislation. Mm-hmm. And so basically it says, if you lose wages as a result of one of the 6 qualifying reasons, mm-hmm. which means you've been diagnosed with COVID, you have symptoms of COVID, you have been ordered quarantined by a healthcare provider, or schools are closed and there's no childcare. There are 6 very specific qualifying reasons. So if one of those 6 applies to you, and as a result, you cannot work, and therefore you're losing wages that you would otherwise be making, well, then this legislation builds in a mechanism for you to have wage replacement. Mm-hmm. Depends on what the qualifying reasons are, and it determines how much of your wages are being replaced, but that's essentially what it is. And to your point about reimbursement, if you qualify, if you go out on leave, if I provide you with the wage replacement as stipulated in the legislation, then the government is going to reimburse me for any of that wage replacement that I gave you. So it's not going to cost me as the employer, it's not going to cost me anything. It's going to be a little frustrating. It's going to kind of be an administrative hassle, but financially, it's not going to cost me any money because the government's going to reimburse me.
Okay. And what's the fuss about it? Like what people go back and forth about, specifically FFCRA?
Well, they just want to be exempt because everyone just always wants to be exempt from any legislation. It's like, so I'm going to try to find some way buried in all of the legislation that allows me to just be exempt and I don't have to mess with it.
Okay. And exempt on an employee side or an employer?
Exempt on the employer from having to provide the wage replacement dollars.
Okay. But if it's covered by government, like what's the big deal?
Exactly.
Yeah. Okay. I guess that leads me to the big question. The second question is, I think now you just have to deal, if that's the case, you have to deal of like adding more team members and bringing people back. And I think when I was talking to one of our offices and I said, I would love to have team back, but what would be a good topic to talk about? Like there's nothing else we can discuss, right? They said for many dental offices across the country, it's been really challenging to bring the team back, adjust the schedules to new guidelines, and hire new team members.
Totally. That is the challenge. So step number one, and let's take this in a very well planned way. And unfortunately, a lot of offices didn't plan it this way, and so on. So
not our Zen offices plan to the T.
Got it. So back a while ago, I would have gotten word from my state that says, as of this date, I can reopen. So
okay.
As soon as I know when I can reopen legally, then the next question is, when can I reopen relative to primarily PPE? And when am I going to have the masks, the gowns, and the things you mentioned earlier that allow me to meet the requirements and the guidelines as stipulated by OSHA and CDC relative to PPE? So once I get a check in the square about PPEs and I get a check in the square from my state saying I can open, now I put word out to my team that has been laid off or furloughed and basically say, Yahoo, as of this day, we're going to be reopening. And here is, in a sense, an offer of reemployment or an offer of reinstatement to your position as of that day. Now, in some cases, a practice may go, all right, on day one when I open, I may not be able to afford, or it may not make sense to bring everyone back on day one. Maybe I bring back only one or two of my assistants instead of all 4 or 5. Maybe I bring back one hygienist instead of the 2 that I let, etc. And so that's just making some smart business decisions given what you anticipate your level of business to be. So I first look at when I can legally open. I second look at what about specifically PPE and availability and compliance with all of that. Now I have a set date. I communicate with the team about reopening. And now I'm going to hear back, in a sense, one of 3 things from these team members. 1, Yahoo, yay, I'll be there. I'm looking forward to it. Number 2, I want to, I'd love to, but I can't because I have no childcare, or because someone in my family is immunocompromised and at high risk, and it's been recommended that I don't go back. Sort of this gray area in the middle. And the third answer is someone says, I'm retiring, or I'm changing careers, or I am not going to work anymore. Well, in the case of number one, everything's fine because this employee is saying, yes, I'm coming back. In the case of number two, you have to drill down to the reason that the person is giving. Some reasons rise to the level of COVID-19 related, which requires the employer to look at ways to accommodate, to look at workarounds to support this person, and or shifting dates, shifting job duties, shifting responsibilities, doing more telework. You just have to figure out how potentially to work with that or work around it. If you can't work around it, then it raises the specter of, does this person stay furloughed and laid off in hopes that whatever the reasons are will change over time and this person can come back? Or you look at the leave provisions in the FFCRA so that this person is effectively reinstated, but almost like on day one goes out on FFCRA leave. Mm-hmm. The third category, the person retiring, the person changing careers, well, that's where you now have to go out and begin the process of finding a replacement. And that follows the same sort of path that you've always had to follow, which is, what are your sources for potential employees? You look to existing team members and say, do you know of anyone who might be a great addition to our team? You can do advertising. You can look at temp agencies. You can look at placement and permanent agencies, Indeed, Dental Post. You just look at any and all of the resources that have been utilized in the past to find a replacement person. It's not unlike someone else who at any point in time came and said, hey, Tiger, I'm quitting, or hey, Tiger, I'm moving, and you have to deal with that. Mm-hmm. So that's kind of the process. And of course, the challenge is this isn't as simple as, Tiger, I'm moving. This has got all of these additional layers in it, and some number of these layers bring with it, sadly, unfortunately, risk and liability to the practice, the owner, the employer.
And so in case two, if it's something COVID-19 related, you're suggesting just to work with a team member, try to address this thing, see if you can adjust things, shift things around to make that work. If it doesn't work and the person still doesn't trust the office or the entire team about the practice of COVID-19, and they don't want to do the FFCRA, then they go into phase 3. Basically, they're saying no, and they're going to stay unemployment.
Well, they're going to stay on unemployment, but technically, if I offer you a job, you turn that down for some reason, I attempt to accommodate that to still support you having a job. Either I can't accommodate or you still say no. And then I say, okay, well, I will reinstate you and put you on FFCRA leave, and you still say no, then you will have effectively voluntarily resigned your position in the practice. And by your resignation and your refusal to take any of the opportunities I have offered you, you now will most likely lose unemployment.
Okay, let's play a very small, hopefully percentage of cases, a scenario where, let's just say I'm a dental office. I want to bring a team member back, which probably already happened by now, but we're going to retrospectively help some of the offices with paperwork.
Sure.
So I want to bring a team member back, and it's a case too where we have a discussion. They say, well, I'm concerned to come back. What have you done? as an office to prevent things from the COVID-19. Then I go through the whole procedure, the temperature, and all the things that are required, and I say, this is what have we done.
Right.
And the person says, well, I would love to come back, but I don't want to do X, Y, and Z. If the job actually says that that's what you need to do, I don't technically have a choice, right? So if
Correct.
the job requires you to be in a patient's mouth and, and you're asking to do something else, well, I'm offering you to come back for that position.
Correct.
Then it sounds like I have two options. I either can offer the person to come back and then do the FFCRA if they qualify, but the question is if they will qualify. If not, then I offer them the job and they technically saying no. What are the paperwork as an office do I need to do?
Okay. So first of all, just back real quickly to the FFCRA. Under the example you just gave, the person would not qualify.
Okay.
Because they're just saying, well, I'm anxious, I'm scared, or whatever. But remember that there are 6 specific criteria, and being anxious and scared is not one of them.
I keep forgetting.
It's hard.
Mm-hmm.
So
6, not 3.
Yeah, there's 6. So to your point then, if I've jumped through however many hoops and I've tried to do all the stuff and the person is still saying no, that is, like I said, basically a voluntary resignation. So there's paperwork associated with a voluntary resignation. If the person won't sign that paperwork, well, then you can, in a sense, you make this person's layoff permanent. And by making it permanent, it ends the employment relationship, etc. Again, some employees, for good, bad, right, or wrong, are looking to play this relative to unemployment, and especially the additional $600, which, as we all remember, goes away July 31st. So the unemployment little anomaly, so to speak, goes off the table as of July 31st. But if an employee attempts to sort of, play both sides against the middle and make that work, by doing that, they risk losing all unemployment. Unemployment basically says, while you're unemployed, we're going to give you this money, but you are to be looking for work. If offered work, you are supposed to accept that work. If you're offered work and you refuse that work, you run the risk of losing all unemployment. So then it just becomes, I don't know, whatever you want to call it. It's kind of like a little chess game on the part of potentially sometimes employees to figure out how to make all that work.
Yeah. And I do want to address both sides because I have heard the comments on both ends, the employee and employer. And I did want to get off the chest the first part with employers that, some of the offices are struggling out there to try to bring their team members back, but the unemployment is so much better.
Right.
And if I have a choice, I don't know what I would do if I would be in the employee side. So I'm from an employer standpoint, is there any paperwork that they need to make sure that everything is documented, that they offer someone to come back? The reason was case 2, the COVID related. We documented, we show everything we've done, and the person still wasn't comfortable. Like, what would you recommend?
Again, there's the ending of employment paperwork. There needs to also be documentation that you offered employment and it was turned down. So if this communication exchange has been done via email, you want to have these things printed out. If the communication is done all verbally, then ideally you put that in writing so that it is documented, and ideally there is your signature and there is the employee's signature, sort of just confirming that the conversations took place and this was the end result. One of the reasons for that documentation is, and I know in one of our previous webinars, we talked about PPP loans, and PPP loans have this whole element of forgiveness associated with them. It used to be that the conditions associated with PPP loan forgiveness were pretty strict and pretty tight. And recently, about 2 weeks ago, they passed new legislation that opened up or made the PPP loan forgiveness criteria a whole lot more flexible. It used to be that the funds had to be spent in 8 weeks. Now it's 24 weeks. It used to be that 75% of it had to be spent on payroll, and now it's 60% on payroll. So there's a whole lot of flexibility now associated with that allows employers to navigate the PPP loan forgiveness part. Now, back to this documentation. In the PPP loan forgiveness, there are 2 additional criteria. And one is you have to have your staffing level back to 75% of what it was. That used to be 100%. Now it's 75%. And there's also wages levels have to be back to what they were pre-COVID. But built in there, they have built in some provisions that say, if you have offered reinstatement and someone has turned it down, and that's why your staffing level is down or your payroll is down, that's not going to count against you, provided you have the documentation that shows you offered and it was turned down, and the reason that your staffing level and your wages aren't up to the level they were pre-COVID is because of the people's turning down or refusal to come back to work. So you've got to have that documentation to help navigate through the PPP loan forgiveness criteria and process.
That's nice.
Mm-hmm.
That's an interesting add-on.
Now, let me add one other part to this, Tiger, and that is when you were saying, okay, over here on the employer side, and if employees truly are making this more money on unemployment right now until July 31st than what they might make if they were working for me, especially if I have PPP loan money, why not provide people with a signing bonus? Why not provide people with a reinstatement, let's get back to work thing? And I just provide everyone with some extra money for the last week here in June and for the month of July.
Yeah.
I could give raises. I could give bonuses. I could give signing bonuses. I could give a Yahoo, we're all back to work thing. Thanks so much. Little spiff. Or I could do all kinds of things that would actually be a really valid use of some PPP loan money, and all of it would be forgiven.
Right. Especially if we look at it from a standpoint that it will be forgiven. Like you said, 60% needs to be spent on payroll. So essentially, and what's the total percentage of forgiveness out of the whole loan?
100%.
Oh, it can be 100% be forgiven?
Totally.
Oh my God.
Yeah.
We live in America.
100%. You just got to cross a few T's and dot I's, and they've built in a lot of flexibility that at this point makes it, I would say this, well, between you and me and the rest of the people on the call, you got to
keep it secret, everyone.
Yeah, you got to totally screw up to not get this thing 100% forgiven now.
Wow. So, we talked about the leadership capital last time. I think to me, when I looked at the situation of some people want to stay, and again, there will be some cases where the team members don't want to come back, and some people, maybe they have change of hearts. They don't like the industry anyway. Maybe they want to do something else. It's totally fine. I think there's going to be few people that are on that, in the middle, in the gray area where they try to make money, milk the cow until July 31st, and then come back and look for work.
Yeah.
I think it creates a negative on both ends. Like, I don't know how I would, as an employer, would look at that employee when they do want to come back. And at that point, I don't know if I want them back. And I think the second one is, I think in this case, the responsibility is on both ends. If you're on the side of employee, and it's my total subjective opinion, not related to Zen Supplies, hopefully, if you're on the employee side and you have change of hearts, just let your boss know, your office know. Like if somebody on my team would come and say, look, I have this opportunity, I don't know what I want to do. I'd be like, all right, fine. Like, at least you're honest and we can work it out. When you do know, let me know. And if not, then not. Then we will terminate things. And then on the other end, I think on an employer, and it's that leadership capital that you've built with the team to be able to communicate back and say, look, we've been shut down for two months, 3 months. I even had one office. I wouldn't say who. I don't want to disclose anything, but they were open on a Memorial Day weekend because everyone wanted to work.
Yeah.
And I don't blame them. The whole doctor asked, the team said, yes, let's go. We all want to work. The patients want to come in and see the doctor. They worked through the whole Memorial Day weekend.
Yeah.
And to be honest with you, I'm proud of that. Like, it's the team decision. They all,
Totally.
And he's like, I didn't have any problem bringing anybody back. To me, that's that leadership capital that particular doctor was able to build to be able to communicate properly and bring the team back.
I could not agree with you more. I've been on this little rage over the past, say, 30 days or so, as people have done this reemployment, reopening piece. And to your point, I believe that we have seen, noticed, and heard there is a direct relationship between the leadership, and you're referencing leadership capital, the leadership and leadership capital, and how easy or hard their reemployment process has been. When there is good leadership, when employees are looked at truly as a resource, as a human resource, as opposed to just an expense, when they're looked at as a resource and the leadership capital is in place, those practices have had no trouble reemploying people. The more trouble you have had reemploying, I think that's a direct reflection on the lack of or poor leadership or leadership capital that exists. So for a whole lot of employers and dentists in this situation, there is an opportunity, and it's a pretty clear feedback mechanism to say, what's the measure of my leadership? The more trouble I've had reemploying, there's something wrong with my leadership. The easier that process has been, it's basically some feedback that I must be doing some things right from a leadership standpoint. And accessing that, I ask dentists in presentations and seminars a lot. I'll start off, I'll say, what is your reputation as an employer? Is your practice one where people want to come to work? I know of all kinds of practices that have resumes of people who have come, dropped off, basically said, I don't know if you're hiring or when you will, but based on what I've heard and what I know about you in the community and the area, when you have an opening, I want to come to work here. Well,
I gotta ask.
That's just a great reputation.
I gotta ask you a follow-up question. Just from a sample of offices that you talked in and different doctors and office managers, can you give? And this might be off the subject. Can you give what the good leadership is?
Well, ultimately, good leadership views people, again, as a resource. They are a person. They're not an expense. They're not just something to be thought of like a piece of paper and a pencil and so on. Number two, this leader has a mental perspective, and that mental perspective is, I work for my employees. My employees work for all of our patients. I would contend, Tiger, that that's your MO, so to speak.
I would have to ask my team.
You work for your team. What can you do to make them happy? What can you do to have them be engaged and energized? What can you do to make the culture of Zen Supplies fun and enjoyable and rewarding? And that doesn't mean it's all just playtime. It means you guys bust your butt and you guys work really hard, but you are connected with them in a way that has them know that you truly appreciate and value them as people, as human beings. And so I could throw the question to some degree back to you and say, what are 3 to 5 things over the last couple of years that you have done within Zen Supplies to foster employee engagement?
I appreciate that curveball. I don't know if I'm ready. I can tell you one thing that I've learned and I've experienced with a lot of our offices in the past, I would say, especially since the COVID started, since March, I hear a lot more the concept. I hope nobody will get offensive with the word. It's a shit sandwich.
Mm-hmm.
You know, we used to get a feedback. You're doing phenomenal. There's always a but, and then like there's phenomenal. And I feel that a lot of people taking that approach as like a tool, and it's not working. People know that it's going to be a shit sandwich.
Right.
And what I'm hearing from our offices and when I talk to different people and even from my team, I'd much rather give a feedback, not sugarcoat it, but be genuine. Like what, and then what's the motive behind that feedback? If you want the person to improve, then it's obviously going to be a good feedback for any normal human being to get that feedback, knowing that your motive is to improve. And if you're giving that motive to fire someone, well, it's a different story, but just be clear on why you're giving that feedback. Well, that's my only 2 cents that I got.
Well, and that's perfect. And I'll just go to the place of talking about what is a more effective communication model for dealing with feedback rather than the shit sandwich. Well, it starts with a practice or any business being really clear on their vision. Who are we? What are we doing? What do we stand for? What are we committed to doing? And this stuff is clarified and put down as truly the vision and the commitment of this organization. Well, now you have a responsibility as an employee, and your responsibility has some specific duties and job, expectations and so on. But another big piece to your job is helping us accomplish our vision. If there's something in your performance that is off in terms of our ability to accomplish the vision, then my communication with you goes something like this. Tiger, as you know, our vision is but. Our commitment is this. What I'm experiencing from you is something that's off from whatever that is. Basically, we have a gap. Here is what we say we are going to do or we're aspiring to do, and this is what is happening. I want to have a conversation with you about how we can close the gap, how we can get. So I'm not making you wrong. I'm not being punitive in any way, shape, or form, because if we are all on board in accomplishing this vision and there is something happening that's not doing that, we just need to close the gap. Now, in the process, I may ask you, help me understand why how you're doing this works in terms of our vision. You may give me an answer and I go, I didn't even think of that. That's actually really cool. Yeah. Or you can give me some kind of feedback and I'm going to say, I appreciate that. And here is, because I am the leader, I'm the employer, I get to set some direction and tone relative to the accomplishment of our vision.
Yeah, I think that's a challenging part. I think a lot of times people in a leadership position, and I think I've seen that many times, is communicating the vision is one thing, which is a challenge for a lot of people, but I think also setting that vision is pretty hard, or taking the leadership or the responsibility of setting the vision,
Right.
what that practice would look like. And I think I want to circle back on this, Tim, very quick, again, with your perspective and your experience, that when we talked about good leadership, and you say mental perspective of I work for my employees, have you seen people mixing it up for, like it's not so much I will do whatever you say to the employee. It's like I work for my employees in a way I need to provide every single tool and everything I can, but it doesn't remove the responsibility of managing the team and everything else that comes with it. Like I think I've seen a lot of, and I don't know if I'm making sense, I have seen that concept, I work for my employees, taking in a completely wrong direction where it's not beneficial for anybody.
I agree completely. For me, the context that I have in there is I have to look at a definition of leaders or leadership and a definition of management. Those are two very different things.
Absolutely.
Leaders focus on people and outcomes. Managers focus on results. Now, I get in small businesses, sometimes I might be wearing the leadership hat, part of the day, and then I'm wearing the management hat part of the day. But it's really important to recognize that leaders and leadership is about people and outcomes, and management is about results.
It's gold. I really like it. I don't think I've seen this being formulated that well. And why do you think it's difficult for people to wear two hats?
Well, I think some of it's just basic personalities, because the manager is a little more detail oriented. The leader or leadership inherently is a little more visionary and a little more big picture and a little more ideally human, people, touch. Again, management can be analytics. It can be evaluating results objectively. And sometimes you can lose the person in that process. So there's some inherent, almost like personality aspects that are a little different. And it can be pretty challenging for people to sort of flip-flop. And it's why sometimes really great managers don't make really great leaders, and really great leaders don't make good managers.
Yeah, I certainly have seen it. If somebody's listening right now or watching and they're like, well, according to Tim and Tiger, I really suck as a leader. I can't get half of my team back. And I hope people don't take it personally. I think you said it right. Use it as the feedback mechanism to improve moving forward. So what would you do then?
Well, one of the aspects is to look at your organizational culture. And you can ask yourself this question: what is my current culture? Now, sometimes people will go, well, my business or my practice does not have a culture. Well, I will tell you that that's absolutely wrong, because every business, every practice has a culture. The question is just, is that organizational culture there by default or there by design? Unfortunately, a whole lot of organizations with their organizational culture, it's there just by default. No one's ever really thought about it, and it just sort of evolves and happens. It's a byproduct of personality also. You are a little more of an easygoing, fun-loving kind of guy. The culture of Zen Supplies is going to reflect that, whether you give that any
thought or not.
Mm-hmm. There can be another person who, by personality, not right or wrong, just the nature of them, a little more serious, a little more formal, a little more rule-based, well, that's going to be part of defining the culture there. There's no issues about only this culture is a perfect culture and this kind doesn't work, all that sort of stuff. It's more important that the culture fits with the leader / owner, because they, of course, own it, run it, and set the tone for all that. So you think about organizational culture, and ideally you think about it from a more proactive standpoint, like, who am I? What do I stand for? The type and kind of business / practice I want. What would make it be really enjoyable for me to come to every single day? These are things that help start to define what the organizational culture would be. And then it's just a matter of starting to put in place. This is not rocket science. It's just a matter of actually just giving some conscious thought to it and starting to apply that, so you end up with something that is a little more integrous in terms of how the business operates. And a whole lot of organizational cultures come about, again, by default, or because someone said this or someone said that, or I inherited this or I inherited that, and then it's just all goofed up.
Mm-hmm.
So if someone's questioning leadership and what can I do, you don't have to go out and read a bazillion books and take all kinds of courses, because leadership is not like, here is the only aspect of a leader. I'll mention 3 people. One, Oprah Winfrey, an incredible leader. Yes. Gandhi, an incredible leader. Totally. And we could mention some other people. I had someone else in mind I like, but you see, these people's personalities and how they go about and or went about leading was very different. And I think we would all agree these people are, in fact, are effective leaders. So it's not a thing that says all leaders are charismatic, all leaders are outgoing, all good leaders are that. No.
There's no staple.
Leader.
Mm-hmm.
Does that help?
Absolutely. I think being genuine in that case is actually more important. I think one of the common traits in leadership is that being, absolute genuine and, admitting the things that you know and you don't know. And I think that's the hardest thing for dental. I think as a dentist, you're more in a manager mindset because you're result driven, right? Like you're working within a millimeter space and everything result driven. And that's where I think a lot of good leaders that I've seen in dental, these are the people that were able to step out from that role and just look at, from a leadership standpoint, okay, so who are the people, what are we trying to accomplish, and what are the outcomes we're looking for?
Yeah, totally. Let me just add one quick thing there. And we were talking about sort of the challenge and dilemma that exists in dentistry relative to, okay, I'm a dentist, I own a practice, I'm a leader, but I'm also a manager. A dentist is one other thing too, and that's a principal producer. So we could say you're a manufacturer also. Mm-hmm. Well, now it's like, okay, which hat do I have on right now? And each of those hats carry with them very different and distinct responsibilities and capabilities and so on. And like you said, when I'm doing dentistry as the producer, or in a sense manufacturer, I'm down in this small little cavity and millimeters and all that. And yet from a leadership standpoint, in theory, I'm supposed to be looking at more the big picture and visionary. That's a pretty significant shift.
Mm-hmm. Yeah, that's interesting. How, if we took a big segue into leadership, which I'm super happy we did, I think your experience and from what you've seen is very, very important, because I think, for any organization, small dental practice or a large, corporate out there, leadership is always going to be the key, right? and I think it's important that we dove into it with some of the keys that you've learned. Anything going back to, on the unemployment side, any specific documents or anything that can help our offices that I missed, that I should have asked, anything that you can recommend, or on the PPP forgiveness guidelines, anything that, in the details that I should have asked and I didn't ask?
No, I don't think so. I'll add these couple of things. Relative to PPP loan forgiveness, please understand that once you've cleared whatever period is and you've spent the funds and you think you're ready to apply, the bank is not going to do any of the forgiveness grunt work or homework for you. There is an application. The application is 11 pages long, and it's a nightmare in terms of what you got to fill out to then submit to the bank. Know that the bank has 60 days to review your forgiveness application, and at that point, they forward it to the SBA, and the SBA has up to 90 days to review it and determine eligibility for loan forgiveness. Well, if you add 60 and 90 together, you have 150 days, which is almost 6 months. It's just 5 months. And so just know that the whole loan forgiveness process is not in any way, shape, or form instantaneous. And there's a lot of work that you have to do in terms of completing the application and how everything is completed and filled out. So it's not like going to be waving a magic wand and poof, you've got loan forgiveness.
Mm-hmm.
I don't think I have anything else on PPP loans and loan forgiveness. Relative to reemploying, I appreciate it's a challenge right now. I appreciate there's the unemployment anomaly for basically about 30 more days. Like I said, you can use PPP loans for a little incentive bonus or a, signing bonus or kinds of things like that to help deal with that issue. And we just appreciate that it's a dilemma that's there. Back to the piece about employees, and particularly employers who have had challenges and not had challenges. Well, some of that, again, is leadership, and it's about team, and it's also about people, both the leader, employer, dentist, as well as the team, a willingness to take a long-term view versus a short-term view. Right now, the short-term view might say, I'm staying on unemployment to make this extra money and stay home, even though they otherwise could work. The long-term view is, well, I take short-term, I jeopardize my potential job or the opportunity at this practice. And some of the things you said about attitude and commitment and so on. And if I take the long-term view, it's like, I'd rather have stable, secure employment for the next 2, 3, 5, 7, 10 years versus 30 more days of a $600 extra from unemployment. So that's just about attitude. It's about outlook. It's about perspective. It's about short-term versus long-term sort of orientation.
I have an interesting question. If an employee during the COVID was home and she took advantage of the downtime and learned a ton, let's just say a dental assistant or the front office or the hygiene, took courses, certifications, understands all the PPE requirements and all budgeting and anything that could potentially add benefit to the office.
Absolutely. Now
that person comes back and maybe somebody will have assumption that they will come back at the same rate. But if that person truly can bring an additional value that wasn't there before, how would you recommend that person approach the employer about potentially increasing the wage or about an additional pay?
Well, I think first of all, you start off by covering the bases that you just mentioned. It's like, doctor, during this downtime, one of the things I committed myself to was, elevating my knowledge or my expertise or how I could contribute to the practice. And during this time, I took this course, here's my certification, I followed through on this, I took this webinar, and so on. And so what I'm bringing, I believe, is more knowledge, more expertise. With that, I would also like to ask you to consider increasing my responsibilities, because I can now cover this, or I could be our expert on PPEs, or our expert on ensuring that we're crossing T's and dotting I's with OSHA and CDC guidance and guideline. Let me be the go-to person in all of that. And now if this person wants a bump in salary at that point, it's okay, they can talk about that. The person could also say, and I'm willing to prove to you the value and my worth, and that if you agree with me, what if we sit down in 3 months, or we sit down in 6 months and we evaluate what I'm getting paid, because I believe what I'm going to bring is increased value and I'm willing to prove it.
I think that's a key point, the way you mentioned. If I put my employer hat as well, as obviously we love when good team members come back with additional things, and they bring things to the table that weren't there before. And I think it's interesting how you even approached it. You said ask, not request, right? These are different, and prove, because a lot of dental offices right now, what they're looking and thinking is, how am I going to recover the lost production from March, April, and May, like these 3 months, and that's going to be on their mind. And the first gut reaction, if somebody will come in and position it in the wrong way, I want more money, then it's just going to be like, are you kidding me? So I think having patience and having that, having audacity is great, but having that patience and ability to prove, I think that's going to be the key, and really just deliver what you said you're going to do.
Yeah, totally.
Awesome. As we are wrapping up, anything that you foresee coming up in the next, do you foresee that July 31st getting extended? Do you foresee any other legislation being passed or anything like that?
No, at the present time, I don't see, or we're not hearing anything about the July 31st piece being extended. If anything was to change, we anticipate there's a likelihood that the FFCRA will not expire on December 31st and may go into next year. And the reason for that is that, as we're all reading and hearing on news, the flare-ups and the increases in COVID cases as economies and states have reopened, that's going to potentially linger or continue. And the impact then on schools this fall, childcare availability this fall, all of that thing is going to be potentially rearing its head longer than just through the end of the year. So if something were to change, we would see there's possibly going to be an extension of FFCRA. Other than that, I think the challenges you and dental offices face with ensuring the quantity of PPEs necessary, whether that's N95 masks or that's different kinds of gowns, disposable, reusable, all that sort of stuff, just making sure that people truly have the quantities to ensure a safe and healthy environment for both the patients there as well as everyone working there, all the employees.
That's amazing. That's a really good point. I think I would love to have a conversation sometime in August to see how people are dealing with post that July
Yeah.
31st expiration.
Yeah.
Just curious how that's going to work.
Yeah. That'd be fun.
Yeah, that's awesome, Tim. It's always great. Like, I think you and I by now have built that
We got a cool
like
connection.
that really good relationship where I feel super grateful to have you. I think you bring a ton of knowledge to our offices. I can't even describe to tell you, like, I literally, I swear to God, it's truth. We get, at least I talked to 2 doctors that said that was extremely valuable, the 2 webinars that we did before, and you did bring a lot of good value. I don't know if somebody reached out to you after that from us, but we highly recommending to all of our offices. We're putting the links and everything to reach out to you for any HR related help. And I'm super excited that you and I are on the same page about leadership. The points that you brought up, I live by them too.
Yeah.
I can't say that I'm always perfect, but I think that's the whole point of leadership, is not being perfect. But I'm super grateful, Tim. Super, super grateful.
Well, thank you for the opportunity. It's always fun. I agree with you. I think we have a really cool connection, and I love the opportunity to share the information and hope it helps.
Thank you so much.
All right.
So have a great 4th of July next week, and hopefully we'll connect in August.
Okay.
I look forward to it.
Bye.
Thank you. All right. There were no questions. Thanks for all for participating.